Well, we've all heard the expression, no pain, no gain. But when it comes to exercise, it's important to understand the difference between the good pain of muscles growing and strengthening versus the bad pain of maybe a possible injury.
And Dr. Tim Henne, orthopedic surgeon with River Valley Orthopedics and member of the Mercy Health orthopedic team, is here to walk us through how to tell the good pain from the bad pain. Dr. Henne, I said orthopedic an awful lot there.
Yeah, absolutely.
So I'd say kind of tongue twister a little bit.
Absolutely. And for those people who do exercise,
She looks at me because I have an aversion to it.
I'm slacking a little bit too. But you know, as we were talking about, what is a good pain to experience during exercise, just so people at home know?
Yeah, sure. You know, I think you can expect it, and you know, most of us, especially if we haven't exercised in a while, will start to experience some muscle pain as you start being active again. And you know, that would typically be felt in the muscle bellies, away from the joints. Things that we worry more about are your joints, your ankles and knees, your shoulders. That's kind of the thing that starts to get us interested when we hear patients talking about it.
Yeah, and I think one example you had, like say if someone goes to the driving range and perhaps they're swinging that golf club, right? You kind of feel that tenderness when you're done.
Yeah, absolutely. You know, your rib cage can hurt a little bit, especially if you'd swung the clubs all winter by now. Hopefully that stuff's been worked out. But if the thing that's kind of slowing you down is your shoulder, or you get home from the driving range and you can't sleep that night because your shoulder hurts, night pain's a big one that we talk to patients a lot about, and maybe a reason to call your orthopedic surgeon.
Okay.
People, when they exercise for the first time, often say, well, I found muscles I didn't know I had. That's pretty true, isn't it? I mean, your body really is working areas that haven't been worked. So stretching, I'm assuming, is always an important part before you do any exercise routine, right?
Yeah, stretching helps. I mean, I think it helps maybe hurt a little less afterwards, and it can kind of get some blood flowing to critical joints that you'll be using when you start exercising. I think the thing that we worry most about is when these aches and pains start getting in the way. So, you know, the message that we have to patients typically is that exercise is so important to your physical and mental health. It helps you sleep, it helps you feel good. And if there's a joint pain that's getting in the way of doing stuff, you know, if there's a reason why you're not getting off the couch and walking, that reason is because your foot hurts or your back hurts, and that really is a great time to involve an orthopedic surgeon. Yeah, a lot of what we do is not surgery. It's, you know, providing advice and helping you feel safe getting off the couch, giving you peace of mind that that pain isn't the thing that's going to cause a problem for you later on.
Do you ever find that some people say, man, I wish I would have turned to you a long time ago?
Yeah, absolutely. And you know, the appointments with us are typically a lot friendlier than people think they are. I think you hear orthopedic surgeon, but we don't drag people off to the operating room all the time. There's a lot we can do with injections and therapy and really just advice. You know, it's just helpful knowing sometimes that these pains aren't serious and you can exercise safely when you have them, and I think that's what a lot of folks are looking for when they come to see us.
I guess that was my next question. I mean, you hear the word surgeon, you think surgery.
Right.
So can you detail a little bit about the other things and how you treat people?
Yeah, for sure. You know, I think you know, the appointments with us are mostly it should be like calling your friend on a phone. If you knew an orthopedic surgeon, you had something that was worrying you and wondering if you could do something. You know, we answer questions for people, and most of what I do in my office is coordinating physical therapy and talking about injections or thinking about braces. And a lot of it's just advice, getting x-rays, talking to folks, examining their knee, making sure that they're not causing harm. And for most people, I think they're willing to tolerate a little pain and in the interest of being active, and we can give you a lot of peace of mind that isn't surgical.
So the big question, do you ice it? Do you put heat on it? What do you do?
I think it depends.
Okay.
So, you know, in general, kind of a rough rule of thumb is if you're warming up and getting ready to go do something, heating it up is great. It'll help you have less pain. It'll help you maybe get off the couch a little easier, do something a little easier, but afterwards, ice is a great idea. People who regularly ice a sore muscle or a sore joint in general have less pain if they're doing it.
All
so
right.
Both are true.
We used to keep frozen peas in the bags and then just slap that on. I had shin splints and stress fractures growing up.
Right.
Come to find out, it was my feet.
Right.
So people need to realize there could be something else like that causing
Yeah, it's all
problem.
related. And you know, looking at a sore knee and looking at a hip and a foot at the same time is important. We still tell people to use frozen peas, which is, you know, people look at you, you have these degrees and years of schooling, and you tell people to get frozen peas. But sometimes it's just that simple.
Right. Leave them in the bag, by the way. He doesn't
also
even take
true.
them out of the bag. And
Pea farmers must love you.
Yeah, right. Yeah.
Right?
I mean, the corn people are like, come on, what are we? Chopped liver?
Yeah.
I mean,
Yeah,
beans,
right. That's a good
any
point.
of that kind
We have
of
an
stuff.
endorsement deal, right? Just make money
Very
every time
cool.
I say that on TV.
All right, so just listen to your body and don't let things drag on too long. I mean, you could be 25 and feel like you're 80, and you don't have to live that way. So
Yeah,
we need
it's
to
true.
realize that.
Yeah, exercise is important, motion is important. It's a key thing of what we do. People suffer less from depression, they sleep better, they feel better when they're exercising, and you know, orthopedic surgeon can help you. That's what we do.
Sounds good. All right, well, to get in touch with Dr. Henne and the Mercy Health Orthopedics team, just head online to mercyhealthorthopedics.com. Thanks for stopping by.
Yeah, thanks so much for having me. It's fun.
Absolutely.